Malnutrition is a huge challenge which is faced just not by India, many other developing countries as well as developed world. NFHS 5 data just came out which showed about 36% children who are stunted, almost 32% children are underweight and almost 21% children are wasted. To address this issue of malnutrition, here at IIT Bombay with extensive research and latest technologies, we have come up with the Health Spoken Tutorial under Spoken Tutorial project. And our goal is to reduce infant mortality rate in our country drastically by creating tutorials on effective breastfeeding practices, milk transfer and nutrition recipes for mothers and children after 6 months of age.
Spoken tutorials are 10-minute long audio-video tutorials created for self-learning. Using this method, we trained 7 million students on IT topics. Using the same method, we created health spoken tutorials, using which we trained health workers with incredible results.
These tutorials are made in 14 Indian constitution languages as well as few tribal languages including Korku, Santali, Bhili, Paura, with a team of pediatricians, gynecologists, nutrition scientists, graphic designers and many others. We have created these 3 tutorials which are simple to understand and rich in information.
We reach down to the grassroots level by strengthening the already existing government infrastructure. We impart trainings to medical institutes, nursing colleges, ASHAs, Anganwadi workers, staff nurses and medical officers using these tutorials.
या दिवसापासून आम्हाला बेबी फीडिंगचं ट्रेनिंग झालेले आहे. त्या दिवसापासून आमच्या वार्डचे जे एसएनसीला जाणारे बेबी असतात त्यांचा रेट आता खूपच कमी झालेला आहे. आमच्या मॅडमांनी जे शिकवलं त्याबद्दल आम्ही खूप आभारी आहोत.
There is content learning, practical workshops, cooking demonstrations, live mother-baby breastfeeding and skill demonstrations.
The first 1000 days of life, starting from the time the mother conceives the baby till the child is 2 years of age, is the time which is the most crucial in a child's physical and cognition development. It is of utmost importance that the child receives correct and complete nutrition during this time. Hence, along with teaching the correct breastfeeding techniques to the mother, we have made innumerable tutorials on recipes made using local and seasonal produce. We train the healthcare workers regarding the breastfeeding skills, breast milk transfer, child's growth, maternal nutrition, dietary diversity and complementary feeding.
पहिली गोष्ट माझा विश्वासच नव्हता. त्याच्यामुळे माझी पहिली मुलगी तिचं वजन आणि उंची खूप कमी आहे आणि माझं बाळ वर्षाचं होऊन गेले पण त्याचं वजन आणि उंची दोन्ही पण आयडियलमध्ये आहे. ही टीम जर माझ्याकडे आली नसती तर खरोखरच माझं बाळही माझ्या आधीच्या मुलीसारखंच हे बाळ पण कमी उंची आणि कमी वजनाचं झालं असतं.
Using the Q-Tree software, we made our tutorials suitable for problem solving. For example, if a baby doesn't gain sufficient weight, it may be because it doesn't get enough milk. Our software will point the health worker to the exact location in the health spoken tutorial ways of solving this problem. Similarly, solutions will be provided to several other problems, including those in complementary feeding.
After the training, what these healthcare workers are recommended to do is to follow few mother-child diet starting from 9th month of pregnancy till about when the child turns 9 months of age.
Master trainers are chosen from the trainees who show at least 80% results in the babies. This exercise ensures on-field learning of effective breastfeeding counseling skills, understanding of milk transfer in terms of weight gain achieved by the baby as per the World Health Organization growth charts.
A study was conducted in Banaskantha district, Gujarat, where an experimental group of pregnant mothers were taught effective breastfeeding skills using health spoken tutorials in the last month of their pregnancy.
After seeing these results, various districts like Nandurbar, Bardoli, Ahmedabad Municipal Corporation took up our health spoken tutorial pedagogy training and implemented in their respective districts.
So the outcomes that we are seeing now after these health spoken tutorials have been put to use is in terms of the weight gains that babies have been having. We've concluded a World Breastfeeding Week competition where we saw weight gains to the tunes of 500 to 700 grams in a week, something that Nandurbar used to see in 1 or 2 months of time span.
Our method has a dashboard that can be used by the administrators to check the progress. Every baby counts.
Our approach is to strengthen various departments of government, including health, ICDS, tribal welfare, and also education. Niti Aayog has uploaded our health spoken tutorial on the Poshan Gyan portal. Maharashtra University of Health Sciences have included our tutorials in their curriculum of nursing colleges all over in Maharashtra. Uttar Pradesh ICDS director invited our team to train Anganwadi supervisors. Besides that, State Institute of Health and Family Welfare, Gujarat, had taken up training on health spoken tutorial pedagogy for all the key people from 33 districts of Gujarat. We would like to invite central, state and local administration as well as like-minded people, NGOs and other institutions to eliminate malnutrition from our country in the shortest possible time.